Hi, my name is Candace Prince. I'm a student physical therapist assistant with Jeff State, and today I'm going to go over the treatment plan for my patient who has osteoarthritis in her left hip. So, a little bit about my patient. She's a 64-year-old female who was referred to physical therapy by her doctor after a diagnosis of OA in her left hip. OA is the progressive destruction of articular cartilage in weight-bearing joints. She also has a past medical history of OA in both of her knees, and her symptoms from her OA in her hip have started affecting her about 6 months ago. So some of the subjective and objective findings that we need to reassess after each session. A subjective finding is that she complains of pain in her left groin that radiates down the front of her thigh. So we need to reassess pain after each session. The objective findings that we need to reassess is that she has decreased active range of motion and passive range of motion in her left hip extension. So we want to make sure that all of the therapy things that we're doing is helping with the hip extension. So what we're going to do today is a joint mobilization. We're going to do an anterior glide on Danette's left leg, and that's going to help extension of the hip by increasing the extensibility of the joint capsule. So we're going to do a grade 3. So you just relax your leg. I have it. It's not going to fall, I promise. All right, so we're just going to come straight in until we feel resistance. So the objective findings that support performing an anterior glide to the hip is that my patient is lacking 10 degrees of active range of motion extension in her left hip, and she's also experiencing a lack of 5 degrees passive range of motion extension in her left hip. Alright, so the patient education that we're going to go over with Danette today is in the morning you have a lot of AM stiffness that lasts for a little over an hour. So, but your hip actually feels better when you get up and you warm it up with movement. So every morning, what I want you to do is just move your leg forward, to the side, and back. Forward, to the side, and back. Just to warm it up and get it ready to get moving, and that way maybe it'll help some of the morning stiffness that you're having so it won't last as long. Alright, so the exercise that we're going to do today is part of your home exercise program, and all it is a seated hamstring stretch. The objective data that kind of goes along with that is that the hamstrings were tight upon palpation. So, all you're going to do is sit with your legs in front of you. You're going to make sure that your back is good and straight. Don't lock your knees out, so have them very slightly bent, just enough to where it's not locked. And then you're just going to slowly move your hands down towards your feet. You're still going to keep your back straight. And as soon as you start to feel a pull in the back of your legs, I want you to hold that for 15 seconds. And then you're going to slowly come back up to relax. So you're going to do this. You're going to do 2 sets of 10 twice a day. So the reason I chose a seated hamstring stretch is because we want to decrease the left hamstring tightness for this patient. And she's let us know that her symptoms seem to ease when she takes weight off of that leg.
So being in a seated position is not going to put any excess force on the hip while she's trying to stretch her hamstrings.
All right, Danette, so if I could get you to stand, get up here. So you want to make sure that your legs are not locked, your knees are not locked. You want to have your toes pointed towards the ceiling, straight back, and I just want you to walk your hands down your thighs or down your legs until you feel a good pull in the back of your thigh. I don't want it to be painful, so if it starts to be painful, just take your hands and kind of walk back some. Make sure that we keep a good neutral back. Hold it for 15 seconds, and then come back to the starting position. And then between each set, or as needed, take a 10 to 15 second break.
So at the reevaluation 4 weeks later, this patient has a 15-degree increase in her left hamstring length that's seen through the hamstring test. She went from 45 degrees on the left to 60 degrees on the left. Her strength has increased with her hip extension from a 4 to a 4+ on the left. The palpations of the hamstring were unremarkable at the re-eval, so the hamstring tightness has been decreased. She also has a negative Thomas test on the left hip, but she does require further interventions for strength and endurance. There is no known cure for osteoarthritis, but my patient's prognosis is promising for symptom management and functioning with physical therapy interventions. The physical therapy that she receives should emphasize the importance of muscle strengthening around the joints, as well as weight-bearing activities to promote a sense of normalcy of her daily life. The muscle strength around the joints is going to allow her to perform more activities without increase in symptoms as much as without any kind of physical therapy intervention.